We are
the Mercer University Public Health Association.
And today we're going to show you a glimpse of public health at work in our community.
I am public health.
What is access to healthcare?
Access to healthcare is having the timely use of personal health services to achieve the best health outcome.
1.9 million Georgians did not have health insurance last year, and 28.2% of Macon residents live below the poverty line. The Federally Qualified Health Center in Macon, Georgia provides a discount program for anyone without health insurance. This health center also provides routine physicals, diabetes management, and health education.
Do we have a sustainable and fair healthcare system?
In order for this to happen, we must have appropriate access to facilities, services, and funding.
I am public health.
The United States is one of the wealthiest nations in the world, yet a significant portion of the population still lives in poverty. People with low income are more likely than those with higher income to become ill or die at younger ages.
The unemployment rate in Macon is above the national average. Georgia has the third highest poverty rate in the U.S. Here in Macon, that rate is double.
16.9% of all children and 18% of children under the age of 6 live in poverty. Minority and racial ethnic groups are much more likely to live in poverty. In addition, female-headed households are significantly more likely than married families to live in poverty. Public health efforts here in the Macon-Bibb County area, including the Loaves of Fishes Ministry, the Middle Georgia Community Food Bank, the Salvation Army, and the Meals on Wheels programs are crucial to poverty reduction. I am public health.
According to recent studies, our very own community of Macon, Georgia is flooded with rampant drug use and alcohol abuse, leading to dangerous, life-altering side effects and potentially fatal outcomes.
Studies recorded marijuana and prescription drugs to be the most commonly abused drugs, with approximately 4,693 users and 2,055 users, respectively. They also recorded about 769 cocaine addicts. Hallucinogens, inhalants, and heroin accounted for another approximate 600 users.
Rehabilitation is the first step to recovery. More centers, organizations, and initiatives are being developed to address addictions and to combat mental disorders in Bibb County. In addition, policymakers in Macon have been persistently pursuing bans on cigarette smoking in parks, bars, and local pubs. The Breathe Easy campaign is an ongoing initiative that seeks to educate and inform residents of the city of Macon about the very real dangers of exposure to secondhand smoke.
Though drug use and addiction can leave a person lost, alone, desperate, and depressed, there is still hope.
I am public health.
According to the CDC, direct health costs attributed to obesity have been estimated over $75 billion. Also, 1 in 3 young children in grades 9 through 12 do not participate in rigorous physical activity.
According to the CDC, 50% of American adults do not engage in the recommended amount of physical activity. Also, between 1960 and 2000, obesity rates among adults have doubled. That's 60 million adults, or 30% of the U.S. population, that are now obese.
Today, about 1 in 3 children and teens are overweight or obese. Overweight children are 70% more likely than normal weight children to become obese adults and are more likely to have low self-esteem and poor body image. To address the significant issue of obesity, organizations in Bibb County have partnered up in a campaign to stop childhood obesity. This campaign is to help encourage children to step away from the TV, video, and computer games and to fill the empty playgrounds.
Education is an essential component of action to promote health and prevent disease.
Health literacy is a critical part of empowerment.
People's health status and life expectancy increase in tandem with their levels of education. Each year, nonprofit organizations in the Macon area invite residents, community leaders, and representatives from healthcare, education, government, agriculture, and nutrition to convene for an annual health summit. This free, multifaceted educational program includes various speakers, breakout sessions, a health expo, and opportunities to bring grassroots changes to our community.
We hope this video campaign will inform others of public health's vital role in our community. Why?
Because we are public health.